If you're over 60, please pay close attention for the next few moments. What I'm about to share could help protect your memory, your independence, and your peace of mind. Some of the most commonly prescribed medications in America may quietly speed up memory loss, and many seniors take them every single day without ever being warned. Now, this isn't meant to scare you. It's meant to empower you. Memory changes don't happen overnight. They creep in slowly, a forgotten name here, a misplaced item there. At first, it just feels like a normal part of getting older, right? But what if part of the problem isn't aging at all? What if something you trust, something prescribed to help you, is quietly working against your brain? As we grow older, our brains become more sensitive. They process chemicals differently, and they recover more slowly. Certain medications that might have been harmless when we were younger can suddenly have much stronger effects on our thinking, focus, and recall. Doctors prescribe these medications for good reasons: to relieve pain, to help us sleep, to calm anxiety, to control blood pressure, or to manage allergies and bladder issues. These drugs are often necessary and helpful, and most people take them exactly as directed. But here's the concern that few people talk about. Some of these drugs can interfere with the brain chemicals that are essential for memory and attention. Some can increase confusion, while others can worsen forgetfulness over time, especially when they're taken together or for long periods. This doesn't mean they cause dementia, but it does mean they may contribute to a faster cognitive decline in some older adults. And most seniors are never told this risk. You might notice a mental fog, slower thinking, or trouble following conversations. You might feel less sharp than you used to. It's easy to blame yourself or worry that something serious is happening. You might even feel afraid to speak up. But you are not weak. You are not failing. And you are definitely not alone. Millions of adults over 60 take multiple medications every day. This is called polypharmacy. And when drugs interact, the brain often feels the effects first. The good news: awareness changes everything. Once you understand which medications might affect your memory, you can have much safer conversations with your healthcare provider. You can ask better questions. You can explore alternatives. You can protect your brain while still managing your health conditions. In many cases, simple adjustments can make a real difference. In this video, we're going to calmly and clearly walk through 9 popular medications that research has linked to faster cognitive decline in seniors. No confusing medical jargon, no panic, just clear, respectful information you can use. We'll also talk about common aging mistakes that unknowingly put memory at risk. And later, I'll share some gentle daily habits that can help support your brain health at any age. Because here is something important to remember: it is never too late to protect your mind. But before we get to the solutions, you need to understand the problem clearly. Some of these medications may already be in your home right now. And one of the most common ones might really surprise you. Let's slow this down and talk calmly. Knowledge works best when it replaces fear with clarity. As we age, our bodies change in fundamental ways. Our liver and kidneys don't clear drugs as quickly as they used to. Our brains become more sensitive to chemical shifts. This means medications can stay active longer in our system and affect our thinking more powerfully than they did when we were younger. Consider this: many seniors take 5 or more prescriptions every single day. Now, add over-the-counter drugs for pain or allergies, maybe add a sleep aid. Suddenly, the brain is trying to process a very heavy chemical load. This doesn't mean these medications are bad or should be forbidden. It just means some of them require extra caution after age 60. Let's talk about categories, not about blame. First, we have medications with what are called anticholinergic effects. These drugs interfere with a key brain chemical called acetylcholine, which is essential for memory, focus, and learning. Drugs in this group include some for bladder control, older types of antidepressants, motion sickness pills, and certain allergy medications. When taken long term, they might contribute to confusion, forgetfulness, or a general mental slowing in older adults. Second, there are sleep medications and sedatives often prescribed for insomnia or anxiety. They work by calming the nervous system, but they can also dull our alertness and impair short-term memory. In seniors, these effects can linger long into the next day, making you feel groggy and out of it, especially if you take them nightly for long periods. Third, strong pain medications, including opioids. These are often necessary after a surgery or for a serious injury. They reduce pain by slowing down the nervous system, but long-term use can affect concentration, reaction time, and overall clarity of thought. Fourth, certain anti-anxiety medications. They are designed to relax the mind, but over time they may reduce mental sharpness and even create dependency in older adults. Fifth, some heart and blood pressure medications. Now, most of these are incredibly safe and truly life-saving, but a few can cause side effects like dizziness, fatigue, or mental fog, especially when the dosage is high. Sixth, we have the older antidepressants, specifically the tricyclic types. Newer versions are generally gentler on cognition, but some of these older ones are still commonly prescribed and might impact memory in seniors. Seventh, acid reflux and stomach medications, especially when used continuously for years. Emerging research suggests that very long-term use might affect how our bodies absorb certain nutrients that are important for brain health. Eighth, muscle relaxants. They're great for calming spasms, but they also depress the entire central nervous system, which can cloud your thinking. And finally, number 9, over-the-counter combinations. Think about cold and flu remedies. Many of these contain those anticholinergic ingredients we mentioned earlier, often without clear labeling on the front of the box. Now, here is the most critical point of this entire conversation. These medications do not automatically cause dementia. That's not what I'm saying. What they can do is increase the vulnerability of an aging brain, especially when they are used long-term, at high doses, or in combination with each other. The real danger here is silence. Many seniors assume that memory problems are just a normal part of getting older, so they don't mention it to their doctor. And doctors may not connect subtle mental changes to medications unless they are specifically asked to look into it. Another common mistake is just taking medications exactly as prescribed years ago and never reviewing them. A prescription that worked perfectly at 50 might not be the right fit at 70. And what about seeing multiple doctors who don't communicate with each other? This happens all the time. Each prescription might seem reasonable on its own, but together they can overwhelm the brain. So many people believe that stopping or even questioning a medication is dangerous or disrespectful to their doctor. That belief prevents some of the most important conversations you could ever have about your health. You are allowed to ask questions. You are allowed to understand what you take. And you are absolutely allowed to protect your brain. In the next part of this series, we'll move forward with hope. I'm going to share simple, safe, daily habits that help support memory and mental clarity. No matter what medications you're taking, these steps are gentle, they're realistic, and most importantly, they give you back a sense of control over your own well-being. Alright. Let's turn our focus to what you can actually do right now. I want to be very clear. These are not medical treatments. They are simple, daily habits that help support brain clarity and resilience, especially for those of us over 60. They are safe, they are realistic, and you don't need to tackle them all at once. Even one small change can make a significant difference. Let's start with the most important one, doing a gentle medication review. First, once or twice a year, make a complete list of everything you take. I mean everything: prescriptions, over-the-counter pills, sleep aids, allergy medicines, even the stuff you only take as needed. Next, take that list to your primary doctor or your pharmacist. Ask a very simple direct question. Are any of these known to affect memory or thinking in older adults? This isn't being confrontational. It's being a responsible manager of your own health. Then ask if any of your dosages might be higher than what you need now. Sometimes, a lower dose can significantly reduce that feeling of mental fog. And finally, and this is crucial, never stop taking a medication on your own. Any changes must be guided by your healthcare professional. This one habit alone has helped so many seniors feel clearer and sharper within just a few weeks. Habit number 2 is about protecting your brain with better sleep timing. We all know sleep is important for memory, but it's the how you sleep that really matters. First, aim for a consistent sleep and wake time, even on the weekends. Your brain loves a routine. Second, try to avoid sleep medications unless they are absolutely necessary. If you do use them, talk to your doctor about short-term use only. Third, create a relaxing wind-down routine. An hour before bed, dim the lights and turn off the screens. Gentle stretching or reading a book can signal to your brain that it's time to rest. Better sleep directly translates to better attention and recall the next day. Next up, habit 3. Eating to support your brain chemistry. You don't need a strict, complicated diet. Start by having protein at breakfast. Think eggs, Greek yogurt, or some nut butter. This helps stabilize your brain chemicals right from the start of the day. Also, make sure you're including healthy fats every day, like olive oil, avocados, or a handful of nuts. These are essential for your brain cell membranes. Try to limit highly processed foods. All that excess sugar and refined carbs can increase inflammation and mental fatigue. And please, stay hydrated. Even being mildly dehydrated can mess with your concentration, especially for seniors. These small nutritional changes really do add up. Habit 4 is about keeping your brain gently active, not overwhelmed. Your brain loves to be used, but it hates being stressed. So, choose one mentally engaging activity that you actually enjoy. It could be reading, doing crossword puzzles, learning a new recipe, or listening to an interesting talk. Do it regularly, but not intensely. Just 15 to 30 minutes a day is perfect. And whenever you can add some social interaction, a good conversation stimulates multiple areas of your brain all at once. Remember, connection protects your brain. Habit 5 is simple. Move your body to feed your brain. Movement is one of the best ways to increase blood flow to the brain. Try to walk daily, if you are able. Even 10 minutes makes a difference. Incorporate a little balance and coordination work, like Tai Chi, light stretching, or some simple balance exercises by a chair. And as you move, breathe deeply. That oxygen supports both alertness and a sense of calm. Consistency is so much more important than intensity here. Habit number 6 is about reducing your daily cognitive load. The aging brain can get tired more quickly, and that's okay. We just need to work with it. Simplify your routines where you can. The fewer decisions you have to make each day, the less mental fatigue you'll feel. Use reminders, calendars, and notes without any guilt. Think of them as tools that protect your precious mental energy. And please, avoid multitasking. Focus on doing one thing at a time. Your brain will thank you for it, and you'll find your clarity improves. Finally, habit 7. Pay attention to the early signals. Notice any changes, but without panic. Things like increased confusion, feeling sleepy during the day, or a bit of mental fog after taking certain pills. These are signals from your body that are worth discussing with your doctor, not ignoring. You are not imagining them, and speaking up is the first step to preventing symptoms from getting worse. Each one of these habits supports your brain from a different angle. When you start to combine them, you create a powerful shield of protection. It is absolutely not too late to start strengthening your mind. If you've been listening, I want to share something truly important. Your brain is not fragile. It's adaptable, and it responds to care at any age. So many seniors believe that memory decline is just a part of getting older, that once it starts, there's nothing you can do. This belief can lead to a quiet kind of despair, a feeling of helplessness. But the truth is, Science and real-world experience paint a much more hopeful picture. The aging brain isn't static. It can still adjust, form new connections, and improve its clarity, especially when we reduce the stresses weighing it down. Think about what happens when your medication load is carefully reviewed, when your sleep improves, when your nutrition actively supports your brain chemistry, when simple movement increases blood flow, and when you keep your mind gently engaged. Progress doesn't require perfection. It just requires awareness. Now, you might be feeling some regret, wishing you had known all of this sooner. That feeling is completely normal. But please know this. Today matters so much more than yesterday. The small, intentional changes you make today are what protect tomorrow's clarity. You don't need to fear your medications. You just need to understand them. You don't need to stop treatments that are helping your overall health. You just need to find the right balance. You absolutely deserve doctors who listen, pharmacists who take the time to explain, and information that respects your intelligence. And most of all, you deserve hope. Countless seniors have reported feeling sharper, more alert, and more confident after making small adjustments to their routines. They feel more in control of their own health. This isn't because they found some miracle cure. It's because they identified and reduced their silent burdens on their brain. So, if you take medications, please don't feel ashamed. If you've noticed some mental fog, don't blame yourself. Aging is a complex process, and having this awareness is your greatest power. Here is your gentle call to action. Sometime within the next few months, schedule a medication review with your doctor or pharmacist. It doesn't have to be urgent, just intentional. Then choose just one daily habit we've talked about and start this week. Maybe it's one walk, one small nutritional improvement, or one adjustment to your sleep routine. Talk to someone you trust about what you've learned today. Sharing this knowledge helps protect more than just your own mind. And if this video has helped you, please stay connected with our community. Learning together is one of the best ways to keep our minds sharp. You are not alone on this journey. Millions of other seniors are asking these very same questions right now. The more openly we can talk about brain health, the safer and more empowered we all become. Your memory matters. Your independence matters. Your quality of life matters. And it is never, ever too late to protect the incredible person that is you. Thank you for listening so calmly and thoughtfully today. Take good care of your mind.